So in this video we are going to discuss about fibula. As we know that fibula is the lateral and the smaller bone of the leg. It is very thin as compared to the tibia. Now coming to the side determination. As we know that the head of the tibia is expanded in all the directions, whereas its lower end, which is also known as the lateral malleolus, is expanded antero-posteriorly. This is the anterior part and this is the posterior part. Also, the medial side of the lower end bears a triangular facet, and there is also a deep malleolar fossa present posteriorly. So if we are going to hold this bone in the as we can see, this is the anatomical position of the fibula. It is held like a pen. As we can see, this is the upper end, which is expanded in all directions. This is the lower end, which is expanded antero-posteriorly, and this is the shaft of the fibula. So the fibula has three parts: the upper end, this is the shaft, and this is the lower end. So now discussing about the upper end. The upper end is expanded in all the direction. The superior surface bears a circular facet which articulates with the lateral condyle of the tibia. Also, the apex of the head or the styloid process projects upward from the posterolateral part of the tibia. So this is the fibula. So this is the posterolateral part. The constriction immediately below the head, this constriction, as you can see here, the bone is constricted. So this is the neck of the fibula. So this was about the head and the neck. Now first we are going to discuss the lower end. So the lower end, as we know, presents four surfaces. So this is the anterior surface, which is visible. It is rough and rounded. The posterior surface is marked by a groove. The lateral surface, this one, is subcutaneous and can be felt in your leg. It is subcutaneous, present just beneath the skin. And the medial surface bears a triangular facet, this facet for articulation with the talus, and a malleolar fossa which is present posteriorly. Now we are going to discuss about the shaft of the tibia. So the shaft of the tibia presents three borders. So this is the anterior border, which is very prominent. Just medial to the anterior border, this is the interosseous border, and posteriorly we have the posterior border. So the anterior border begins just below the anterior border of the head of the fibula, continues downwards, and then it expands to enclose a triangular area on the lateral surface of the lateral malleolus. Then next, if we see the posterior border, this is the posterior border. It is rounded in the upper part, and below it becomes continuous with the medial margin on the groove of the posterior surface of the lower end of the fibula. Now the interosseous border, it is present just medial to the anterior border. So in the upper part, sometimes it is not clearly distinguishable from the anterior border. So now we are going to discuss about the surfaces. So the surface which is present between the anterior border and the interosseous border is the medial surface. The surface which is present between the interosseous border and the posterior border is the posterior surface, and the surface which is present between the anterior border and the posterior border is the lateral surface. So now coming to the attachments on the bone. So first we will see the attachments on the medial surface, which is visible here. So the medial surface in the whole of the upper 1/4 and the anterior half of the middle 2/4. Okay, whole of the upper 1/4 and anterior part of the middle 2/4 gives origin to the extensor digitorum longus muscle. And from the posterior half of the middle 2/4, it gives origin to the extensor hallucis longus muscle. And the lower 1/4 part, which is left, gives origin to the peroneus tertius muscle. So this was about the attachment on the anterior surface. If we see again, they are extensor digitorum longus from whole of upper 1/4 and anterior part of the middle 2/4, the extensor hallucis longus from the posterior half of the middle 2/4, and the peroneus tertius from the lower 1/4. Now coming to the attachments on the lateral surface. So this one, as you can see, is the lateral surface. It gets twisted downwards. So on the lateral surface, as we know, there are attachment of two muscles. First is the peroneus longus muscle. So peroneus longus muscle is attached on the upper 1/3, whole of the upper 1/3 of the lateral surface, and in the middle 1/3 it is attached on the posterior half. So whole of the upper 1/3 and posterior half of the middle 1/3 gives attachment to the peroneus longus muscle, whereas the anterior half of the middle 1/3 and whole of the lower 1/3 gives attachment to the peroneus brevis muscle. So on the lateral surface we are having the attachment of two muscles, peroneus longus from upper 1/3 and the posterior half of middle 1/3, and the peroneus brevis from the anterior half of middle 1/3 and whole of the lower 1/3. So now coming to the attachments of the posterior surface. So as we can see, this is the posterior surface. So the posterior surface is divided into an anterior part and a posterior part by a sharp medial crest. So as you can see, this is the medial crest, this is the anterior part of the posterior surface, this is the posterior part of the posterior surface. So now the anterior part of the posterior surface gives attachment to only one muscle, and that is the tibialis posterior muscle. So the part between the interosseous border and the medial crest gives attachment to one muscle, that is tibialis posterior, and the part of the posterior surface between the medial crest and the posterior border, that is the posterior part, gives attachment to the soleus muscle in the upper 1/4 and to the flexor hallucis longus in the lower 3/4. So as we can see, the posterior surface in all gives attachment to three muscles. From the anterior part it gives attachment to the tibialis posterior muscle, and from the posterior part it gives attachment to the soleus muscle in the upper 1/4, and in the lower 3/4 part it gives attachment to the flexor hallucis longus muscle. Now on the head of the fibula along the apex there is the insertion of biceps femoris muscle. So these were the attachment and insertion of the various muscles on the shaft and the head of the fibula. Now coming to the ligaments, along this round facet which is provided for articulation with the tibia, there is the presence of capsular ligament of the superior tibiofibular joint. Now coming to the anterior border gives attachment to the anterior intramuscular septum, and in the lower part, as we can see, the anterior border divides to form the anterior margin of the triangular area and the posterior margin of the triangular area. So this anterior margin of the triangular area gives attachment to the superior extensor retinaculum, and this posterior margin of the triangular area gives attachment to the superior peroneal retinaculum. So we are going to discuss about these retinaculums when we are going to discuss about the anterior and lateral compartments of the leg. So then we'll discuss about them in detail. And the posterior border, as we can see here, the posterior border gives attachment to the posterior intramuscular septum, and this interosseous border gives attachment to the interosseous membrane. So these were the attachment of a few ligaments as well as membranes on the shaft of the fibula. So this was the description of fibula. Thank you very much.